Welcome to this edition of Utah Libraries Have You Covered. We're coming to you from the Utah State Library, Blind and Disabled Recording Studios. I'm Jeri Openshaw, along with Jason Powers, our producer. And today we are more than happy to introduce you to Rob Ence. He is the Executive Director of the Utah Commission on Aging. Welcome, Rob.
Thank you, Jeri. It's great to be here.
I'm so glad we finally got you down here. So you're the executive director of a thing called the Utah Commission on Aging. Like we all do, we're all aging. So
it's a popular thing.
It's a popular thing, and it's good. I mean, you want to do that. You want to get as old as you possibly can and in good health. Let's get a little background on you, Rob. Where do you come from? How did you get into this?
I was born and raised in Salt Lake City. I attended school at Skyline. Go Eagles, and attended University of Utah. I have a couple of degrees there, a degree in psychology and a master's of business. So I had kind of an eclectic background, was on my way to medical school at one time, and made a decision to go to work for Marriott Corporation. So I lived in California for a spell, and then returned and worked in the financial services industry. And then finally took off basically 10, 12 years to help my wife start and run a business. We did an apparel company in town. When we sold that, I went to work for a year for Planned Parenthood and then became the state director for AARP, which many people have known in the past as the American Association of Retired Persons, but just AARP. I was the state director here for 10 years. And then I was a regional vice president for AARP up till about 2015, and then retired from AARP. But that was my introduction to working on aging issues and aging policy.
Sure.
When I came from that, the position of the executive director had just opened up for the commission. And we'll talk more about its background in a moment. And I was offered the opportunity to take that on, and so I did in 2016 and been with it ever since.
Wow. Good for you, and we're glad you are.
Thank you.
With it. So 2005, this was established.
Correct. It was created as a governor's commission, and there are many, but this was in statute with the legislature with the intent of creating a roadmap for the future so that government agencies, municipalities, individuals had a good understanding of where the demographic was shifting and what everyone could do to be better prepared to manage that ongoing growth, which is the fastest growth sector in our age population right now.
Right. And baby boomers.
Correct. And it's true around the country, but Utah in particular has a very fast-growing 65-plus, 85-plus population.
Absolutely, yeah.
And so it was organized under Governor Huntsman and under the division of, at the time, Department of Human Services, and then was moved to higher education in 2007 and is now part of the Center on Aging in the Division of Geriatrics at the University of Utah.
Great.
But I do want to say that even though it's housed there, it's for the convenience of accountability and funds flow from the legislature. It actually serves the entire state and all academic institutions, not just the university.
Yes. And that's good to point out because we want everybody to know that this exists for them.
Yes.
So give us a little nutshell, an overview of what the commission hopes to do.
Fine. I really had a wonderful opportunity to revisit this. I was part of the team that started this in 2005. And when I came back and it was available, first of all, there was no ongoing statute. It had to be renewed in 2016, and there was no funding. So
that's how it goes.
That's what you do in retirement. Say, well, here's a challenge.
Yeah, there you go.
And we were able to successfully get it renewed by the legislature and had a baseline amount of funding that actually former Senator Jones created for the state. She was very committed to this cause. So the commission sits at the crossroads between research and academia, public policy, and community service, the hands-on work that's being done in all the communities. And what we discovered fairly early is there needed to be a more central hub, a communications hub that really made an effort to pull these different resources together to make sure we didn't have redundancy in the state, that we were addressing the kinds of issues that were relevant now. When we went through the pandemic in 20 and 21, it
changed
our world a lot. A lot of virtual need evolved, and that's when we created UtahAging.org as the unique virtual resource center for all aging issues for older adults in the state. Another unique thing about the commission is that while we focus on older adulthood, we also address adulthood from age 18 and above, because if you're learning in your 20s and 30s and 40s to live healthy, save money, take care of yourself,
exactly,
the opportunities in older adulthood are going to be more plentiful, but the odds in your favor for sure. So this is about the journey of aging. And
that's sweet. That's a nice way to put it.
And it is a journey, but we want that journey to be as pleasant, as you mentioned earlier, as healthy as possible, live as long as we can in a dignified life.
Absolutely.
And there are things that will happen that will change the course of things, and it creates needs. People have accidents, disabilities, there's injuries, there's chronic illness. And when those things happen, there is an important part of our community that has resources to help address those individuals. But it's not just about the needs. There are also many opportunities in aging, ranging from being engaged in policy, being engaged in volunteerism, taking advantage of lifelong learning, travel, all those things that you would hope would be possible. Yes, creative arts, absolutely. And so, it's just definitely a very optimistic look at the experience of aging and how do we optimize that for every individual in the state.
Let's talk a little bit about some of the resources that fall under that pyramid.
So we have a really robust research effort in the state across multiple universities. And the idea is that we want to make sure we harvest all those good findings. And in addition to that, there is the opportunity to engage with policymakers, not just on Capitol Hill, but also municipal leaders where these issues hit the ground.
Community councils,
advisory boards, on a level of the area agencies on aging. Sometimes there are multiple counties, and then you have the Association of Governments and all those other things. So you have so many opportunities to plug into the thinking and the policy of those on a municipal level.
Right, and that's really important too for people who live in rural Utah. How does this impact them, and who is their, how do they funnel their way through finding out what can work for them?
Absolutely. And then on the service delivery, we have so many partners who are involved in the work of the area agencies on aging, delivering meals, respite care, caregiving support, SHIP counseling, which is for health insurance for people trying to make decisions about Medicare and where does Medicaid fit in, long-term care.
And that can be a nightmare.
It absolutely can be. And it's one of the things we're trying to simplify the process. But people get lost. If they don't have people to talk to who understand how this works, it can be very, very discouraging. So
and they could fall off, they fall right off and not have any health care because they can't understand how to implement it or how to get to it.
And that's the worst possible scenario, is you become somebody who has fallen out of the system, literally almost orphaned in a sense from resources. But there are so many challenges to address the capacity available to people. So what we try to do is disseminate information in as many ways as possible, help people efficiently connect with resources like the area agencies and other non-governmental organizations. And make sure that people have options, that they understand that there are people out there dealing with the same kinds of issues. The worst thing we could do is let people fall off the edge and become isolated because of a chronic condition or another reason.
And it happens.
And social isolation is one of the worst older adult health issues we're dealing with in our state and country right now.
Yep, it absolutely is. So I'm a senior citizen wanting to find out how I can get help from you. What do I do? Where do I go?
So we operate in the state with a lot of our partners in the concept of a no wrong door policy. So if an individual needs an advance directive, if somebody is looking for services to help them with their caregiving needs at home, If they know an agency to go to that has that, they should go directly there.
Right.
If they don't know where to go, we ask that they tap into utahaging.org. And that website has a variety of issues, very comprehensive. It gives a lot of background on the research related to it, the policy related to it, and where to get help.
Right.
And so if you don't know where to go to utahaging.org, and we'll help people navigate to their resource.
To the resource. So other partners, some of the major partners, I know that there are a lot, and they help incredibly. Let's name some of those.
All right. So when the commission was created by statute, there were 21 statutory stakeholders required. Some of them are from government agencies like Department of Workforce Services, the Governor's Office of Economic Opportunity, and the Division of Health and Human Services, or the department, I should say. And so those are required by virtue of their office. The others we get to select, and during COVID, we actually added 3 more so we could add better data collection and we could add technology support, because that's really was a big shift in the way we delivered goods at that time. And so we covered the business sector, nonprofit sector. We have citizen advocates, individuals who work in long-term care. And all of these statutory assignments rotate every few years. The elder law arena, for example. And that constitutes those mandatory statutory lists. But in addition to that, we have probably anywhere from 200, 250 partners from community organizations and, again, the government levels we've talked about.
And by the way, before we go on,
Sure.
These are, you can get information from these partners and there's no charge.
That's correct. In fact, that's a great suggestion. A lot of people feel like, because they're solicited a lot, we can help you with this, you pay for this service, and we'll get you, enrolled in insurance. There are so many free services by these agencies.
That's awesome.
And those individuals need to know how to contact them.
Right.
And I believe we use the term honest broker. Individuals have a need. Sometimes it pops up unexpectedly, and they don't know where to start. And so that's why it's so important to know who some of these honest brokers are and where you can go to get directed to the people who will help you.
And I'm sorry I interrupted you, but so we here at the Utah State Library for the Blind and Disabled, we have a lot of seniors. In fact, so many seniors who work or who use our service for books. We have Braille, we have audiobooks, we have Bard, which is an awesome, on your phone online book service. How does the disabled play into this commission?
So I think we have access for many of our adult constituents. There are some areas we've got work to do. We obviously have audio type communication, but if an individual is deaf, hard of hearing, then the resources are a little more limited. They could read, and so that helps as well. So again, we don't have Braille resources and we don't have signing resources.
But we do, and so we're there here to help you.
And that's why we're talking today.
Exactly.
But I think that's a wonderful project for the future, because we, again, don't want to leave anyone out. We want to make sure that these individuals and or their care partners and family members know how to access resources that will assist people in any circumstance.
And it's free.
That's the best part, right?
Yeah.
You're the honest brokers.
Exactly. Where do you feel like Utah stands as far as serving Utah seniors?
I think we're in a very good place. The challenge for all of our free resources out in the field has to do with funding and making sure that the main funding stream that comes from the federal government, the Older Americans Act, continues to stay fully loaded to meet the demands of a growing older adult population. Sadly, we're seeing in times when those things get cut. The cuts to Medicare, Medicaid suggested, and the overall Older Americans Act. That's a really, really critical thing, that we make sure that it is not
interrupted and that there is good foresight and Congress supports that. Then once it gets to the
The state, through the Division of Aging and Adult Services, which is part of the Department of Health and Human Services, is a very key partner to us. They're more the hands on the ground and directing resources through the state that will enable individuals to get the Meals on Wheels, the respite care, the SHIP counseling, those kinds of things. So that's just a really important conduit. And the biggest challenge is to have adequate resources to meet the demand of the population. We do not have a plan in our country or our state to address the rising costs of long-term care.
It's amazing.
It's a real challenge, and insurance is not the solution. It's expensive. Very few people can afford it. It's limited what it will do.
It's very concerning.
So we have to figure out how to do that. Some families have a network of caregivers with children or close relatives that can help a great deal, but long term, we need to have resources for people so they can age with dignity and grace.
Bottom line, yes, indeed, dignity and grace. I think that is the hope we all have, is that we all are able to do that in good health and with a clear mind. So, yeah. The future of the commission and the resources, how does that look to you?
We're very optimistic about this. In 2023, there have been a number of efforts around the country for states to organize long-term plans for the aging demographic. And an organization, the Center for Healthcare Strategies, sponsored with a couple of foundations the concept of a master plan for aging.
Awesome.
Or
Let's
some
talk
call it
about that.
A multi-sector plan for aging. And we became involved with that very early because we'd already had some semblance of what a plan could look like in the state. But then we memorialized it by statute in 2023, and we delivered to the legislature in that fall an outline of what our proposed master plan would look like. So we're now in the first 3-year period of that, refining with our partners, with those who are statutory members, those 6 core sectors that make up the plan. And in addition to that, determine how we want to track the progress as a state, how we want to be measured. And in a nutshell, we're talking about age-friendly environments, ecosystems in health and education in our communities. Number 2, we're talking about what are the things we could do financially to be better prepared and secure. What are the things related to health and health security? Did you have a question there?
No, just so many things.
Yeah, and those each have a lot of things in the bucket.
Right.
But the fourth critical one is doing things that empower people so that they're taking charge of their lives. There's an adage I use all the time. If you don't decide what your future is going to look like, what your advanced care planning is going to look like, someone will decide for you. And what you want to do is make sure you have control over those decisions as long as you're able.
Yes.
That's a really important piece. It also deals with social isolation as well.
Oh.
The fifth sector is around caregiving. It's going to be our greatest need in the future. Everybody will be cared for or caring for someone at some point in their life.
Yep. Yes, indeed.
And the resources need to be understood, readily available, and people just need to know that they can get support out there. And the 6th bucket for the master plan in Utah is to make sure that every individual has access and understanding how to use the technology safely. We're increasing broadband services throughout the state, especially in rural areas.
That's great.
But in addition to that, we need to have tools and equipment, whether they're iPhones, iPads, laptops. And then the most important thing is once people are introduced to the internet,
how to use them.
And safely. Yeah, and that's the big charge of the commission, is to make sure people can access critical information on health, travel, anything we've talked about, and do it through technology, but they have to know what to watch for, because great technology, but great opportunity for fraud.
Yeah, exactly. Scams. And the elderly are prime targets.
They are indeed.
They are indeed. How many, or at least who, has been responsible for putting this master plan together?
So the commission network, we've been gathering data for years. And so in 2023 spring, when we were asked by the legislature to, memorialize this, we had several workshops within the commission body at our quarterly summits that we hold and other work groups that helped us narrow down the topics, what were going to be the most important things, what surveys had been done by Division of Age Adult Service that informed us where we might have gaps. So it was a collaborative effort, and then finally refined down. And not that I'm great at it, but I suppose I served as the final editor on pulling it all together. And then we had review, we had public comment for a period of time. And so it is not a static document. It's intended to be dynamic.
Fluid, right.
And so these first 3 years will inform us a great deal of how we're going to measure things and how it's going to play out over the next 10 years. But it's a rolling 10 years.
Exactly.
And the legislature, we report to them every year on the progress.
That's great. Well, here's the conundrum. This commission, the umbrella of this commission is so broad, and there's so many things to specifically introduce and talk about that I think it would behoove us. I think it would be great if you came back or some of our partners came back, and we did more podcasts, and we could make this continuing episodes of the Commission on Aging, if you'll be willing.
We'd love to do that. Each one of these buckets has a great deal of information underneath it, a lot of issues to understand, and the more that we can share with people, the better it will be.
Right. So, bottom line, if we want information, where do we go again?
UtahAging.org.
Rob Ence, it's been a complete pleasure. We will be back with you. You're coming back. That's all there is to it.
Thanks, Jeri.
This is a very broad subject, something that we can't capture in a few minutes. And so, we'll have you back.
You have a deal.
I appreciate you coming in today and
my pleasure.
Sitting with us. Thank you so much.
You bet.
Thanks for joining us today. We're coming to you from the Utah State Library, which is a division of the Department of Cultural and Community Engagement. Services offered through the Utah State Library include library services for the blind and disabled, the Bookmobile program, Book Buzz for book groups, Utah's online library with useful databases, and Libby for audiobook checkouts, and so much more. Check out all the services at library.utah.gov. That's library.utah.gov.